Hi, my name is Rohit and I'm your ADT and today I'm going to be doing your intake. Can you please tell me your name?
My name is Rihanna.
Full name, please.
Rihanna Brannett.
Okay, do you have any preferred name or pronouns?
You can call me Rihanna.
Okay, any pronouns, preferred pronouns?
See her.
Okay, what's your date of birth?
1990, September 28th,
Okay, what's your address?
13518, Greencastle Beach Terrace.
Mm-hmm.
Yeah, that's my address.
Uh, what,
Maryland.
what's the city?
Wattensville.
Okay, and what's the phone number?
414-328-8065.
Okay, and email?
Um, should I say the email?
Yes, please.
Rihanna.brannett@gmail.com.
Do you have any preferred contact method?
You can send me your email.
Mail is good.
Yeah.
Okay. What about emergency contact?
Um, I think mine is fine.
No, I need somebody else's name.
My friend.
What's her name? What
Aaron.
him or her?
She's my friend, cousin friend.
Okay. What's her name?
Aaron.
Okay. A full name, please.
Jovic.
Okay. All right. So how did you hear about our service?
One of my neighbor, I guess his relatives was admitted. I mean, he came here
Mm-hmm.
and he got better with that. And my friend got the information, and neighbor with through those neighborhood friends, I came here.
Okay. Do you have a name for the neighbor?
I don't remember her full name.
Only the first name is okay.
I think it goes with Tina.
Okay.
And her husband. I don't remember the husband name, but the wife name is Tina.
Oh, okay. Okay. So what brings you to counseling at this time?
I mean, um, frankly speaking, I get very angry like nowadays.
Mm-hmm.
I cannot manage my anger. I feel like I need to take because I was when my friend introduced me to smoking marijuana.
Mm-hmm.
So I used to smoke almost every day. It's been since 5 years.
Mm-hmm.
Now, if I don't mm, get to smoke it, I feel like angry, or I feel like then I need to break something or mad, and I cannot control, and that brings some that brings some disrupt in my family,
Mm-hmm.
and also I've had an urge of having, and if I don't get those, I feel like impulsiveness to steal money from my family.
Mm-hmm.
So those all are things. My family member, actually, I don't want to really to come, but my family member, like my fiance told me to that I need to come here, so I came here.
Oh, okay. Okay. So you said this has been going on since 5 years. A
Yeah.
little bit of.
So I wasn't that much dependent, or maybe like I had to take almost 3 years. Like
Mm-hmm.
I've been taking regularly, but
Mm-hmm.
it's been almost, I guess, 5 years.
Okay.
If I do remember.
Okay. So to summarize, so you have been on marijuana for 5 years, but then you have been taking it like regularly since the last 3 years, and your fiance and your neighbor, so they recommended this practice, and then you're also having issues with anger and issues with stealing. So
Yeah.
am I right in all this?
Yes, impulsivity of doing something like urge that comes that I have to do it then and now. I wasn't like this earlier.
Mm-hmm.
I had a history of anxiety,
Okay.
and I had a history of kind of panic attack, like kind of social anxiety. So to cope up with this, one of my friend introduced me to that, and I started feeling good, because then I was very much not a public speaker, and then I was like very shy, um, an introvert. So taking marijuana helps me to boost up my self-esteem. So I started taking now. It became a habit that I take almost every day. If I don't take, and then I don't know, my fiance realized that, but I was too mad and angry if I don't get an irritability and agitation in a small thing. And then they will reach out to my friend, and she told to my fiance, because it has been referenced by my neighbor, so
Mm-hmm.
that's why I guess it's more behavioral problems
Mm-hmm.
because of that
Okay.
consequences.
Okay. So did you had any did you had any treatment for anxiety? Did you take any medicine for
Uh,
anxiety, for panic attacks, or
uh,
it was just limited to yourself?
no, I think I was prescribed sertraline. I think sertraline, and then no, before that I was being prescribed Lexapro.
Mm-hmm.
I had like kind of depression also,
Mm-hmm.
but I didn't take medication. Lexapro, 10 something milligram. I don't remember in the top of my head.
Mm-hmm.
So then I did not take medication because it helped. I had started having a headache,
Mm-hmm.
so I stopped it, and then I didn't took it, and my anxiety became more worse.
Mm-hmm.
So to cope up with those, I need to. I started having kind of panic. I don't know. As far as I remember, it was because I didn't able to give those marijuana. I had a panic attack, or to
Mm-hmm.
cope up with panic. It was like by then and then.
Mm-hmm.
So after that, yeah, it became a habit.
Okay. So when did the anxiety symptoms appear?
So anxiety symptoms were with me from almost like from small when I
Mm-hmm.
was like I don't even remember from my middle school I guess,
Mm-hmm.
because I was being raised by my single mom.
Mm-hmm.
My dad was on and off from my life,
Mm-hmm.
so and there was a history of like mom and dad back and forth. That's why I guess it was in a middle school, and I had also had to gone through a lot.
Mm-hmm.
So, and when when I finished my high school,
Mm-hmm.
then I need to go to the college. So it was a bad anxiety, even in speaking in front of my doing a project. So
Mm-hmm.
I think one of my friends introduced after that,
Mm-hmm.
and
So,
it was very helpful for me taking a marijuana because mm, it used to release my anxious and
mm-hmm.
anxiety,
Mm-hmm.
and I used to feel better.
Mm-hmm. So okay. So when did you start taking medicine for the? When did you first take the medicine for the anxiety?
Mm, I think it's like
How many years back?
uh, I think it's like it was a 5 years back because I started first back, and since I had a headache, and I stopped it, and then that's why I started taking it.
Oh, okay. So it was not like not
Excuse
that
me.
far.
Mhm.
So first the anxiety, you started the medicine, and then it didn't work, and then so you started. Oh,
Yeah, I
okay.
mean, I had a headache. I could
Mm-hmm.
have waited, or I could
Mm-hmm.
have gone to
Mm-hmm.
doctor, and then then he also. I mean, I don't know about sertraline. I don't remember it
Mm-hmm.
taking it,
Mm-hmm.
but yeah, I was on Lexapro.
Okay. So let's rate the severity of your concerns. Okay. So let's rate the smoking of marijuana. So if one is very mild and 10 is severe, how do you think your symptoms are?
I think it's 8.
Okay. What about the anxiety?
Anxiety is worst. That's
Okay.
10.
It's 10.
Mm-hmm.
Okay. Um. Okay. And have you ever received counseling or therapy before?
No, this is my first time.
Okay. And so you said that you had so Alexa Pro and sertraline, but how long did you take it when you took it?
I don't remember taking sertraline, but I remember the doctor discussing with me. Honestly, I think Lexapro I started. I think I took almost 3 months, and I don't think it 3 months also because I used to get a bad headache,
Okay.
so I stopped abruptly. So I don't
Okay,
even
that was
think.
5 years back.
Yes,
Okay, and then after that, no
I
medicine.
was never on medication because I was on marijuana.
Oh, okay.
That makes me feel good.
Okay. So, who is your primary care physician?
Uh, Dr. Bruce.
Okay. And do you have any medical condition or chronic illness?
Yes, I have hypertension and cholesterol, high cholesterol.
Okay. So when did this appear?
I think it's up here. I think it's been 4 years.
4 years. Are you taking any medicine for that?
Yes.
Okay. What are you taking for?
Uh,
Um, uh,
Hypertension.
high blood pressure.
It's Lapitalol, I guess.
Okay.
100 mg twice a day.
Okay. And are you regular on that?
Mm-mm.
Okay.
I'm not good at taking medication.
Okay. What about for the hyperlipids?
Uh,
Cholesterol, sorry.
so I think I take Crestor.
Mm-hmm.
I don't remember how much mg I take, but I recently started taking it
Okay. Like
once a day.
once a day. When did you start taking it? Recently means
It's been a month.
month. Okay. Before that you didn't take it.
Mm-mm.
Okay. Okay. Have you had any hospitalizations for any issues?
Mm-mm.
Okay. Um. Okay. So this may be a little bit, off topic, but this is important to the discussion. So, are you currently have experiencing any suicidal thoughts?
Uh, y- yes,
Okay.
but not with an intent of any plan.
Okay. So no intentions. Okay. What about the frequency?
Uh, it started, I think, 1 year back, and
Mm-hmm.
I had a urge of self harm,
Mm-hmm.
but I used because my friend, I again this marijuana helps me to cope up with those thoughts,
Mm-hmm.
and that's why I was also on the regular basis. So I used it as a coping skill.
Okay. So when did it start?
I think 1 year back.
1 year back. Okay. Before that there was.
No,
Okay. And how often do you have these thoughts?
I think it comes and goes.
Like how often? Like
It's a,
once a month, once a week, twice a week,
I
or
think it's a
like
once a month.
once a month?
Yeah.
Okay. Okay. Are you currently experiencing thoughts of harming others?
No.
You said you have a history of self harm. So have you? Can you please explain?
I mean, yeah, I had a history out of that. I think I told you
Mhm.
impulsivity and like urge. So I thought of like self harming, but again I used marijuana, so I used to distract those thoughts.
Okay. So
So I
on
didn't
on.
even yeah I didn't I only have ideation, social
Okay.
ideation,
Okay.
no self injurious behavior.
Okay. So what about alcohol use? Do you use it? Do you use it like never, rarely, weekly, or daily?
I used to take often,
Mm-hmm.
but right now I'm not taking that much because I think marijuana is taking more priority on alcohol.
So what do you say? Rarely?
Yes, for now.
Okay. Any other recreational drug use?
No,
Okay. What about tobacco or vaping?
I vape
Okay. How often?
3 or 4 times a week.
Okay. Okay. Any other substance of concern?
Mm-mm.
Okay. Who do you live with? Do you live alone, with family, with partner, roommates?
My fiance.
Okay. Just two of you. Okay. And so do you work?
Yes,
Where do you work?
Amazon.
Okay. And what's the highest school level you went to?
Um, I went to. I have an associate degree.
Okay. You have an associate degree. And any plans to go
Yeah.
further?
Yes, I want to be a cosmetologist,
Uh-huh.
but like yeah, I need to get rid of this.
Oh, okay. Okay. And what about you said you live with your fiance? What about your parents?
Um, my mom lives 15 minutes away, and my dad is not in my life.
Okay. What about your friends?
Yeah, I do have some few friends.
Okay. And so they are close.
Yeah,
How many?
there are 3 or 4 friends.
So they also in substance use or they are out of it?
I mean, one of my friend, one of my friend is in a substance, a marijuana too.
Oh, okay. And what about the others?
I don't, I don't know about them internally.
Oh, okay. And so if help is needed, do they help you?
Yes, they give me a help.
Okay, that's good. Good to hear. So what about your sleep?
I don't get sleep. I have a difficult falling asleep, so I take melatonin 3 mg before I sleep.
Okay, so after taking melatonin, so you sleep. So that
No,
it's not a
sometimes
problem.
it depends upon like I have sometimes I wake up in
Mm-hmm.
middle of it, night, so it's a disturbed sleep.
Okay, still disturbed sleep with melatonin.
Yes.
How many hours do you get a sleep per
I
day?
don't remember because I cannot say I remember because it's always varying. Like I don't have enough sleep, and my body gets tired.
Oh, okay. Okay. What about appetite?
Like it depends upon my stress and anxiety because I don't eat much, but if I'm stressed, I eat too much.
Oh, okay.
So I'm a binge eater. Like I have like I don't eat, and I suppressed it.
Mm-hmm.
And sometimes if I'm very much anxious and stressed, and like I eat too much.
Okay. Any recent weight changes?
I don't know about that. I don't want to talk about weight change.
Oh, okay. No
It's
problem.
totally new. But
What about your stress level? If you say one is very low and 10 is high, so what do you rate your stress level?
I think 8.
8. Okay.
Mhm.
And so what do you hope to gain from this counseling?
I want to control like that impulsivity and behavioral change.
Mm-hmm.
Because I feel right now it has been a relationship problem because of it.
Mm-hmm.
Me having a marijuana almost every day,
Mm-hmm.
it affect my partner.
Mm-hmm.
So and I also like if I don't have a money, and then I think I should not have an urge of stealing or get the money from anywhere, anyhow
Mm-hmm.
to get the marijuana. Am I
Okay.
making sense?
Yeah, yeah, yeah. So you want to decrease the marijuana use and work on the impulsivity
Yes.
and also the
Or
stealing part.
urge to steal the
Yeah.
money to get marijuana.
Okay, and to decrease the urge to steal marijuana use. Okay.
Okay.
Yeah, yeah. That's very good. And thank you very much for being so expressive and you know and thank you.
Thank you. Nice to meet you.
Thank you.